Good morning. Our team's name is Angel. So we are constructing a stroke assessment tool, which is known as B.E.F.A.S.T. So commonly, B.E.F.A.S.T is an acronym through which we find out stroke symptoms. If any one of them are positive, there are a risk for having a stroke. So it is a this tool is a comprehensive AI powered stroke assessment tool that helps detect stroke symptoms through the analysis of face, speech, evaluation, and other questionnaires. So now, why we did this is because I am an emergency medicine doctor. My name is Dr. Charles Chaco. When I have been in the emergency medicine, I have seen that the stroke cases are being lately detected. So the stroke always have a timeline. So we must treat stroke within 4 hours. If we do not treat stroke within 4 hours, there is delay in treatment. S- So it is necessary for the patient or the caregiver to notice that they or he or she is having stroke symptoms. Stroke is a common emergency situation seen in India. So B.E.F.A.S.T is the acronym we are using. It is the most common used public acronym for screening of stroke. So so what does it all include is B is for balance, E is for eye vision, F is for face analysis, V is for voice analysis, um, um, S is for speech, and if any of them is positive, so we can see B for balance, E for vision, F for facial drooping. That means there is any weakness on any of the side of the face. A is for the arm weakness. So we will ask either the patient to lift up his arms, or the patient caregiver will be asking the patient to ask if there is any weakness in any of the arms. And if there is any difficulty in speech, if there is any slurred speech or unclear speech, these points show that if any one of them are positive, it is a risky thing for having a stroke. So if there is risk, we must call emergency services, or we must consult a neurologist as soon as possible. So the 4 hour cutoff is very important. So when we do our stroke assessment, we have initially these points. So we will be asking questions like, have you lost your balance or coordination? So we consider that. So when we ask this to the when the patient uses it, the either the patient might use it, or the caregiver might use it. So we have two questions that can be asked to the patient. So if I'm saying that I have lost the balance, I'll be right, yes. So it is an emergency thing. So one thing is like, we can take emergency notice and we can straight away connect with 108, or we can find nearby neurologist. So when we are clicking neurologist, according to our location in the map, I'm connected with the nearest neurologist available. So suppose this is what is happening, I can get the location to whichever neurologist I want to connect. So this makes sure that stroke is being treated at the right time needed, and the patient to hospital time or patient to neurology time for a stroke case is reduced below 4 hours. So this will help in decreasing the mortality and morbidity of stroke patients. I hope this is just one of the diseases that we are doing as of now. Like this, we'll include basic acronyms so that people can use it and people can detect diseases in the elderly care. So, stroke has been common in the young age too. So, that is known as young stroke. So, all these things can be detected by this tool. This is the most common tool used by the public, that can be used for the public for screening. So, this is one of the diseases, that is stroke. We will be using the same form of acronyms and same form of assessment tool for other diseases like heart attacks, a shortness of breath like cough, or small diseases like fever or infections. Thank you.